NGT feeding, prepare and gather equipments, non-sterile gloves, incontinent sheet, sanitizer, feeding, water, kidney tray, NGT syringe, dry cotton, stethoscope, perform hand hygiene. Wear non-sterile gloves. Keep all equipment nearby to you. Explain the procedure to patient. Check patient identity, ask his name and check ID band. Provide privacy. Assessment. Identify signs and symptoms of malnutrition or dehydration. Assess the patient for food allergies. Assess patient's need for enteral tube feeding. Obtain baseline weight and laboratory values. Assess for any problems that suggest lack of tolerance of previous feeding. Verify doctor order for formula, amount, route, and frequency. Auscultate for bowel sounds before feeding. Locate the diaphragm of stethoscope over the right lower quadrant of abdomen. Keep the patient in semi-Fowler or Fowler position. Keep incontinent sheet over the patient. Check placement of gastric tube. Pinch proximal end of the tube feeding. Open the tube and attach NGT syringe. Aspirate gastric secretions and check gastric residual. Measure pH of aspirated gastric content. Auscultate over the left upper quadrant with stethoscope and inject 10 to 20 milliliters of air into the tube. Check the expiry date of the feeding. Warm the feeding. Pinch the proximal end of the tube. Attach the syringe to end of the tube and elevate to 18 inches above the patient's head. Fill the syringe with water according to the prescribed amount. Syringe measurement should face you to give the correct amount of feeding. Permit the feeding to flow in slowly at the prescribed rate. Raise and lower the syringe to adjust flow as needed. Give the feeding at same way to give the water. Amount will be different according to the total prescribed amount of NGT feeding. Be careful to pinch the tube immediately. Before air is entering the tube, administer water as ordered. If patient experience discomfort, pinch or clamp the tube and stop the feeding for a minute. After giving full amount of NGT feeding, advanced tube feeding. Ensure patient safety and comfort. Ask the patient to remain same position for at least 30 minutes. Dispose of equipment appropriately. Remove gloves and perform hand hygiene. Documentation. Evaluation.